Now, India happens to be the second hardest hit nation in the coronavirus pandemic, but interestingly, it has today reported its lowest number of cases for the first time in over 6 months. And also an important announcement, the country is also pledged to start its inoculation drive sometime over the course of the next 10 days. Now, India continues its streak of low daily number of infections as fresh cases have remained below the 20,000 mark for the fourth consecutive day. Just about 16,000 cases were reported in the last 24 hours and only about 200 deaths linked to Covid-19 were recorded. Now, what's also interesting is that India's recovery rate has now climbed up to a jaw-dropping 96.32%. The Covid-19 active caseload remains below 3 lakhs for the 15th consecutive day. It's also the first month since the month of July that the monthly count of cases in India has been below 1 million. The overall burden on the health delivery structure has declined appreciably on account of COVID in India, while there is a bit of a glimmer of hope, and India's Covid-19 numbers are on a definite decline for a combination of reasons, one of which can be attributed to the possibility of herd immunity in India. Now, according to experts, a vaccination program continues to remain important, particularly given the presence of the mutant version of the coronavirus that was first recorded in Britain, and it has also made its way into India and remains a highly transmissible strain. And therefore, the Union Health Ministry in India has said that based on the feedback of a dry run, the central government is now ready to roll out the COVID-19 vaccination program within the next 10 days for emergency use.
So our doctors, our nurses, our medical workers need not self-register themselves on the CoWIN platform. Their data has already been pre-populated. Similarly, our frontline workers, which means people in the armed forces, in state police, in central police, in municipal workers, they also need not self-register themselves because their bulk data is also getting pre-populated. When we would come to the population priority groups, there the provision of registration or editing of data would come.
Now, what is interesting is now the first phase of the drive is expected to be completed sometime in August. The Drug Controller General of India had given emergency use authorization to 2 vaccine candidates by Oxford AstraZeneca and also the indigenous Bharat Biotech on the 3rd of January. WION is now available in your country. Download the app now and get all the news on the move.